My task is a stability task with upper extremity manipulation in a stable environment. It is a discrete and a closed task. My most limiting factor was the individual constraint of fine motor movement. I began learning through discovery. I knew how to tie my shoes with two hands, so I applied the same concept with one hand. I was using my long-term procedural memory because I already knew how to tie a shoe. The most difficult part of the task was getting the first knot tight enough. After a couple of weeks, I switched to a modeling form of learning and watched a YouTube video which suggested stepping on the laces to tighten them. Over time, I noticed my fine motor skills were improving and the time it took to tie my shoes was decreasing. I spent 4 weeks in the associative stage and moved to the autonomous stage in week 5. I added a dual task of tying my shoes while counting backwards by threes. At that point, I moved back into the cognitive stage. I used intrinsic feedback and used mostly my visual system to gauge my progress. Occasionally, I would use my videos as a post-response type feedback by watching them right after I had tied my shoe. While learning my motor task, I used mostly whole task training and massed practice. The only time I took rests was when I was watching a YouTube video or reviewing the videos I had recorded. My practice was constant practice. I practiced in the same conditions every time. I tried to set aside time and focus on my task and practice selective attention. However, there were a few times I had to switch my attention to answer a text or turn off the video recorder. Because I need to tie my shoe while sitting and while it's on my foot, many of the postural control topics, including perturbations and balance, don't apply to my task as we had learned them in class. This project taught me a lot about patience. There were many times that I felt frustrated because I couldn't get my shoelaces tight enough to walk. I'm not used to using such fine motor skills. This is a very real task that patients may need to learn. Not every amputee, stroke patient, or person with a sling wants to wear Velcro shoes. When working with patients, I will recognize that they will face frustrations and to encourage them to work through and keep practicing. When I was frustrated, I sometimes took a step back and tied my shoes with both hands. This allowed me to feel like I accomplished something. If my patients get frustrated, I will encourage them to take a step back and I'll give them a task that I know that they can succeed at. Fortunately, I pushed through my frustrations and successfully tied my shoes with one hand. And in this case, with both hands.